Today on Medical Montana, I'm visiting with Dr. Wyatt Rasmussen here at the Cascade Hearing and Audiology in Great Falls. Dr. Rasmussen, good to visit with you again. Want to continue talking about hearing health, hearing loss. How do I know initially if I have a problem, other than the obvious, which is, perhaps I've got a ringing of the ear or difficulty on one side or the other? How do I know if I've got an issue?
It's funny because the statistics show that people actually don't go in to get help from an audiologist till about 7 years after they first have their hearing loss. So we call it the invisible disease because you can't see it and it takes a while to notice. But there are a few things. You a lot of times may have tinnitus along with the hearing loss, so you'll have a ringing or a buzzing type of sound going on. You can also have kind of a fullness, we call it, in your ears, which basically feels like your ears are sort of plugged or sounds are dampened, but really that's just that hearing loss kind of kicking in. And then, of course, obviously, if a lot of people tell you that you're asking to repeat things or you're not listening, things like that. But it is tough to tell when you first get hearing loss because it's mild. So as it progresses, it becomes more easy to kind of find out.
So typically it's so gradual that you may not even notice you have an issue until someone brings it to your attention. Boy, I have to repeat things
exactly.
a lot.
Which is why, not maybe necessarily every year even, but as you get older, it's not a bad idea to get your hearing checked, just to get a baseline. And then depending on what we find, we may recommend you come back the year after or in 3 years, but at least keep an eye on it because of the fact that it is invisible in a way.
As we age, obviously, these problems become more pronounced. And that's normal, right?
That is normal. Your eyes, your ears, most of the time just genetically you'll just start to have those things deteriorate, and checking on them is going to be a good way to basically be proactive instead of coming in because you have to. It's better to kind of stay on top of it and in front of the problem.
Yes, always a good idea to have good health. Thanks for the time. For more information on hearing loss, contact Cascade Hearing and Audiology.